I'm Carol Furlong. I'm the Director of Substance Use Services here at Elliott Hospital. Elliott Hospital has been working with the Integrated Delivery Network to develop a continuum of services, but particular to the IDN, we are developing a partial hospitalization program. And a partial hospitalization program that addresses both substance use and mental health issues. We know, particularly here in the middle of the opioid epidemic, that nearly everybody who has a substance use issue has an accompanying mental health issue, whether it's depression or anxiety. The opposite is true too, that many people with a severe and persistent mental illness also sometimes turn to drugs to self-medicate those symptoms and develop a substance use disorder. There's not a lot of treatment for people with what we call co-occurring disorders that present at the same time. And there's also some difficulty in finding services along a continuum of care. So people might go to an emergency room to address their addictions or their mental illness, mental health issues. And then the emergency room docs don't know where to send them because there just aren't appropriate treatments available. So we're hoping to provide that necessary service with the partial hospitalization program. It's roughly 20 hours of group, a week intensive group. They'll also have individual therapy. They'll have pretty intensive comprehensive case management services. We'll have a peer support on staff. We'll have an RN who can help address some of their medical needs, and a psychiatric nurse practitioner to address some of their medication management issues and the physical needs. Eventually, after the first couple of months, we'll have an outreach person who can not only go out into the community and locate them if we're not able to locate them after a short while, but also can go out and speak to some of the other community agencies. We want the whole community to work collaboratively in expanding this continuum of care, and the more we know about each other's programs, the better off we'll be as a community. Manchester is one of the hardest hit community in the country in terms of the opioid epidemic. And I'm really proud to say that I think we've come together as a community to address this and make a change in people's lives.